Bone disorders are a diverse group of conditions that impact the health and structure of our bones. These disorders can range from genetic conditions to injuries and diseases that affect bone integrity. Understanding the different types of bone disorders is crucial for healthcare providers to accurately diagnose and effectively treat patients. This presentation will provide an overview of some of the most common bone disorders, their causes, symptoms, and available treatment options. Bone disorders are a range of diseases that affect the health, structure, and function of bones. Common types include osteoporosis, osteoarthritis, and Paget's disease. Osteoporosis weakens bones, making them fragile and more prone to fractures. Osteoarthritis is a degenerative joint disease that breaks down the cartilage around bones, causing pain. Each type of bone disorder affects the bones differently and requires specific treatment approaches. Bones have a dense outer layer and a spongy inner layer, giving them strength and flexibility. Bones serve important functions. They provide structural support, protect vital organs, and enable movement. Bones also store important minerals and house bone marrow, which is crucial for producing blood cells. The detailed illustration on this slide shows the internal structure of a bone, which can help visualize these key points. Bone cells are the building blocks of our skeletal system, playing crucial roles in bone formation, remodeling, and maintenance. Osteoblasts are the bone-forming cells. They produce new bone matrix and facilitate the mineralization process, which hardens the bone. Osteoclasts are the bone-resorbing cells. They break down old or damaged bone tissue, allowing for the remodeling and renewal of the skeletal structure. Osteocytes are the mature bone cells that maintain bone health. They sense mechanical stress and send signals to trigger bone remodeling when necessary. Understanding the functions of these three key bone cell types is essential for understanding bone biology and how our skeleton is constantly being renewed and adapted. Calcium and phosphate are essential minerals for bone health and overall physiological function. Disruptions in the balance of these minerals can lead to bone disorders, so understanding their regulation is crucial. This pyramid illustrates the key factors involved in maintaining calcium and phosphate homeostasis. At the top is regulation. Hormones like parathyroid hormone and vitamin D control the levels of these minerals. Next is absorption. The intestines play a vital role in taking up calcium and phosphate from our diet. Then there's resorption. Bone resorption releases these minerals back into the bloodstream. Finally, the kidneys filter and excrete any excess calcium and phosphate to maintain balance. Bone formation and remodeling are essential processes that occur throughout our lives. Bone development begins during fetal growth and continues into childhood and adolescence. The remodeling process replaces old bone tissue with new tissue, maintaining bone density and overall skeletal health. This homeostasis, or balance, is crucial for keeping our bones strong and flexible. Understanding these bone formation and remodeling processes is key to ensuring optimal bone health and preventing disorders. Osteoporosis is a condition where bones become weak and brittle, increasing the risk of fractures. The main cause is an imbalance between bone resorption, breakdown, and bone formation, leading to net bone loss over time. Risk factors include age, being female, family history of osteoporosis, and lifestyle factors like poor diet, lack of exercise, and smoking. Osteoporosis often has no symptoms in the early stages. Common signs include back pain and gradual loss of height as vertebrae collapse. Early detection and treatment are important to prevent serious fractures, especially of the hip, spine, and wrist. Bone density scans are a key tool for diagnosing osteoporosis, a condition where bones become weak and brittle. There are two main types of bone density scans commonly used. I'll briefly explain each. These scans typically take around 30 minutes to complete. The scan provides a single critical result called a T-score, which indicates the density of the patient's bones compared to healthy young adults. This T-score is a key metric used by doctors to diagnose osteoporosis and determine the appropriate treatment plan. Osteoarthritis is a common joint condition that leads to chronic pain and stiffness, affecting daily activities. Joint pain is a key symptom, often felt throughout the day. Morning stiffness, especially in the knees, hips, or other joints, is another common indicator of osteoarthritis. Excess weight and aging are major risk factors that increase the likelihood of developing osteoarthritis. X-rays can reveal the characteristic joint degeneration and damage associated with osteoarthritis. X-rays are a common first step, with 80% accuracy in diagnosing osteoarthritis. MRI scans are more detailed, providing 90% accuracy in identifying osteoarthritis. Blood tests can help rule out other conditions, though they only have 75% accuracy for osteoarthritis specifically. Analyzing fluid from the affected joint is another useful test, with 85% accuracy. Osteoarthritis is a common joint condition that can cause pain, stiffness, and reduced mobility. There are several treatment options available to help manage the symptoms of osteoarthritis. Medications like NSAIDs can help reduce pain and inflammation in the affected joint. Physical therapy is an important part of treatment, as tailored exercises can improve mobility and strengthen the surrounding muscles. In severe cases where other treatments are not effective, joint replacement surgery may be recommended to restore function and relieve pain. The key is to work closely with your healthcare team to develop a comprehensive treatment plan that addresses your individual needs and goals. Rheumatoid arthritis is an autoimmune disorder where the body's immune system mistakenly attacks its own joints. Genetics, environmental factors, and hormones all play a role in the development of rheumatoid arthritis. Common symptoms include joint pain, swelling, and stiffness, as well as fatigue and fever, which can significantly impact a person's overall well-being. Diagnosing rheumatoid arthritis involves a physical examination and blood tests. Early detection is crucial, as it allows for more effective management and treatment of the condition. This slide provides an overview of the key causes, symptoms, and diagnostic process for rheumatoid arthritis, setting the stage for a deeper discussion of the condition and its impacts. Rheumatoid arthritis is a chronic autoimmune condition that causes joint inflammation and damage. There are several treatment approaches we can consider for managing rheumatoid arthritis. First, disease-modifying antirheumatic drugs, DMARDs, like methotrexate and sulfasalazine, can help slow disease progression. Biologics are another class of medications that target specific pathways in the immune response and can be effective for moderate to severe cases. In addition to medications, lifestyle factors like regular exercise, a healthy diet, and stress reduction techniques can also help manage symptoms and improve overall well-being. Gout is a form of arthritis caused by high levels of uric acid in the body. This can lead to the formation of uric acid crystals in the joints, causing intense pain and inflammation. The big toe is commonly affected, with sudden, severe pain and swelling. Other joints like the knees, ankles, and heels can also be impacted. Diagnosing gout involves blood tests to measure uric acid levels, as well as analysis of joint fluid to look for the presence of uric acid crystals. This helps distinguish gout from other types of arthritis and ensure proper treatment. Gout is a type of arthritis caused by high levels of uric acid in the body. Effective gout treatment involves a combination of medications and dietary changes. Medications for gout include nonsteroidal anti-inflammatory drugs, NSAIDs, and urate-lowering medications. These medications help reduce inflammation and lower uric acid levels. In addition to medications, incorporating anti-inflammatory foods in the diet can help manage gout symptoms. Maintaining proper hydration and avoiding high-purine foods like red meat, seafood, and sugary drinks are key dietary strategies. Finding the right balance of nutrition is important for managing gout effectively. Paget's disease is a chronic condition that affects bone remodeling, leading to abnormal bone growth and potential complications. Medications like bisphosphonates play a key role in managing the disease by helping to regulate the bone reshaping process. Lifestyle modifications, such as regular exercise and a balanced diet, are also important for supporting overall bone health and preventing further complications. Routine checkups with a healthcare provider are essential for monitoring the condition and ensuring effective management. Joining a support group can provide valuable emotional support and the opportunity to connect with others experiencing similar challenges. Osteomyelitis is a serious bone infection that can be caused by bacteria entering through injuries or surgical procedures. Common symptoms include severe pain, swelling, fever, and redness around the affected area. These symptoms indicate an infection in the bone. To diagnose osteomyelitis, doctors will typically order blood tests, imaging studies like X-rays or MRIs, and may sometimes perform a bone biopsy to confirm the diagnosis and identify the specific bacteria causing the infection. Early diagnosis and treatment are crucial, as osteomyelitis can lead to long-term complications if left untreated. Osteomyelitis is an infection of the bone that requires prompt treatment to prevent serious complications. The first line of defense is antibiotic therapy, which targets the infection directly. Antibiotics are often administered intravenously. In severe cases, surgical intervention may be necessary to remove infected tissue. This helps restore blood flow and promote healing in the affected bone. Antibiotics and surgery work together to effectively treat osteomyelitis and prevent the infection from spreading or causing further damage. It's important to work closely with a medical team to determine the appropriate treatment plan based on the specific case and patient needs. The initial assessment involves examining the injury site for signs of swelling or deformity and evaluating the patient's pain level. X-rays are essential for confirming the type of fracture. In complex cases, MRI may also be used to get a more detailed view. The treatment options range from immobilization, such as casting or splinting, to surgical intervention, depending on the severity of the fracture. Bone fractures are a common injury that can occur in a variety of ways, including falls, accidents, and sports-related incidents. There are several different types of fractures, including simple, compound, and stress fractures. Each type has its own unique characteristics and requires specific treatment. When a bone is fractured, common symptoms to watch for include pain, swelling, and difficulty using the affected limb. These symptoms can indicate the need for medical attention. The image on this slide provides a visual overview of the different types of fractures, which can help illustrate the key points I'm discussing. Understanding the types, causes, and symptoms of bone fractures is important for recognizing when medical intervention may be necessary and seeking appropriate treatment. The initial assessment involves examining the injury site for signs of swelling or deformity and evaluating the patient's pain level. X-rays are essential for confirming the type of fracture. In complex cases, MRI may also be used to get a more detailed view. The treatment options range from immobilization, such as casting or splinting, to surgical intervention, depending on the severity of the fracture. Osteoporosis is a rare genetic condition that leads to extremely dense and brittle bones. The excessive bone density is caused by genetic mutations that affect the normal process of bone resorption. Common symptoms include bone pain, frequent fractures, and delayed healing of fractures. Nerve compression can also occur due to the dense bones. Diagnosis is made through imaging tests like X-rays and bone density scans, as well as genetic testing to confirm the genetic mutation. Early diagnosis and treatment are important to manage the symptoms and complications of this condition. Osteoporosis is a rare genetic condition that leads to extremely dense and brittle bones. The excessive bone density is caused by genetic mutations that affect the normal process of bone resorption. Common symptoms include bone pain, frequent fractures, and delayed healing of fractures. Nerve compression can also occur due to the dense bones. Diagnosis is made through imaging tests like X-rays and bone density scans, as well as genetic testing to confirm the genetic mutation. Early diagnosis and treatment are important to manage the symptoms and complications of this condition. Rickets and osteomalacia are conditions caused by deficiencies in key nutrients like vitamin D, calcium, and phosphate. Rickets primarily affects children, leading to bone pain, delayed growth, and skeletal deformities. Osteomalacia is the adult form, causing muscle weakness and increased bone fragility. Diagnosis involves physical exams, blood tests, and imaging studies to assess the severity of the condition. Bone density scans are particularly helpful in evaluating the impact on bone health. Rickets and osteomalacia are conditions caused by vitamin D deficiency, leading to soft, weak bones. Effective treatment involves a multi-pronged approach targeting the root causes. Vitamin D supplementation is essential as it enables proper calcium absorption and improves bone health and density. Calcium supplementation strengthens bones and promotes proper development during growth phases. Incorporating calcium-rich foods in a balanced diet is crucial for effective treatment. Sunlight exposure is a natural source of vitamin D and important for overall bone health. By addressing the key nutritional and lifestyle factors, we can effectively treat rickets and osteomalacia. Bone tumors can be either benign or malignant, and they affect different age groups. Genetic mutations, radiation exposure, and certain medical conditions can cause bone tumors to develop. Common symptoms of bone tumors include pain, swelling, and fractures. Doctors use X-rays, MRIs, and biopsies to diagnose the type of bone tumor and determine the best treatment plan. Bone tumors can be a serious health issue, so it's important to have a thorough diagnostic process to understand what we're dealing with. The first step is a comprehensive medical history and physical exam to gather key information about the patient's condition. Imaging techniques like X-rays, CT scans, and MRIs are then used to visualize the tumor and get a better sense of its characteristics. A biopsy is the next crucial step to confirm the type of tumor by analyzing tissue samples. Based on all these findings, we can then develop an appropriate treatment plan, which may involve surgery, radiation, chemotherapy, or a combination. The goal is to create a tailored approach that gives the patient the best chance of a positive outcome. Bone health is critical for overall well-being, and there are several lifestyle factors we can focus on to prevent bone disorders. First, nutrition is key. Consuming calcium and vitamin D-rich foods like dairy, leafy greens, and fatty fish help strengthen bones and support overall health. Regular weight-bearing exercise is also essential. Activities like walking, jogging, and strength training can improve bone density and reduce the risk of fractures. Managing stress is important too. Incorporating mindfulness techniques like meditation can benefit bone health indirectly by reducing the negative impacts of stress. Finally, prioritizing quality sleep is crucial. Restful sleep supports the body's natural healing and recovery processes, which is vital for maintaining strong, healthy bones. Bone health is essential for overall well-being and quality of life. A balanced diet rich in calcium and vitamin D is crucial for building and maintaining strong bones. Regular weight-bearing exercise, such as walking, jogging, or strength training, helps improve bone density and overall fitness. Avoiding harmful substances like excessive alcohol and smoking is important to protect bone integrity. Routine health checkups and screenings can help detect and prevent potential bone disorders early on. By adopting these healthy habits, we can support our bone health and enjoy a more active, vibrant lifestyle. Bone health is crucial. Regular checkups can help prevent disorders. Understanding conditions like osteoporosis and arthritis is key for early detection. Maintaining a healthy lifestyle with a balanced diet, exercise, and avoiding smoking supports strong bones. These key takeaways summarize the importance of prioritizing bone health and the steps individuals can take to maintain it.